everyone. I'm Dr. Sunita, working at the Center for Pharmaceutical Sciences as a head of the department. And I'm going to talk about types of dosage. Types of dosage forms is more important because all pharmaceutics will revolve around the dosage form. There are several dosage forms are there, like solid dosage form, semi-solid dosage form, or semi-liquid dosage form, and liquid dosage. So now we'll discuss about the different types of dosage. Why we require this dosage form? Because we can deliver the accurate dose, or we are protecting the API either by coating or a sealed ampoule, protection from the gastric juice, or masking the taste and odor, and placement of drugs within body tissue. Sustained release medication also we can one of the types of dosage forms to deliver to the target tissue or sustained action for a prolonged period of time. Controlled release medication, optimal drug action, insertion of drug into the body cavity, rectal or vaginal. Use a desired vehicle for insoluble drug. There are types of dosage forms depending on a route of administration and also physical form. Route of administration, it is divided as oral, topical, rectal, parenteral, vaginal, inhaled, ophthalmic, or OT. Physical form, solid, semi-solid, or liquid. Tablets are hard dosage form, and this is the most promising dosage form, and they are round or oval or square shape, and the different excipients are used in these tablets like a binder, glidant, precipitating agent, sweetener, flavor, pigment. Binders are required to make a tablet's structure, and glidants are required to flow the fluid from the hopper to dye for a compression. Disintegrating agents are required to break the tablet once it is taken, and sweeteners to mask the taste, flavors to mask the taste, and pigments to make the uncoated tablets visually attractive. And there is a second dosage form in a tablet, they're buccal or sublingual tablets. Buccal tablets are kept in the gum and teeth cavity, and sublingual tablets are kept under the tongue. Okay, and these medications dissolve rapidly and are absorbed through the mucous membranes of mouth, where they enter into the bloodstream. And avoid the acid or enzymatic environment of the stomach, the drug is metabolized enzymes of the liver. So, like some protective drugs can be used in the, or immediate action drugs can also be used in the sublingual or buccal tablet. For examples, which we can use this route is vasodilators, or steroidal hormones, or nitroglycerin for angina. And there are always we do some coating to the tablet, because the coating is required to mask the taste of actual API, and also give the smoother and easier swallow, and also make more resistant for the environment and extending its shelf life. And effervescent tablets are another type of tablet. These are the uncoated tablets. Once they come into contact with water, there will be ingredient either citric or tartaric acid and react with the carbonates or bicarbonates and evolve the carbon dioxide. So this is effervescent tablets is dispensed into the water, and the whole drink will be swallowed, or whole drink will be taken for the action. Okay, they are intended to be dissolved or dispersed with water before providing, and they are very rapid dispersion and dissolution, and onset action will be very fast, and they are like a carbonated drink, so the customers can take the medication very easily. And chewable tablets, these chewable tablets are mainly used for the children, and they are swallowed before swallowing. They will be chewed before swallowing. So these are designed for the children, like a vitamin tablets, or some painkillers, or some antibiotics, also the chewable tablets. And capsules is another dosage form. This is a solid dosage form. They are available into two different hard gelatin capsules and soft gelatin. In a hard gelatin capsule, we always put the solids or semi-solids, and soft gelatin capsules, we usually use the liquids or semi-liquids. And the shell is made up of gelatin and some plasticides. Lozenges are another sweet and solid preparation, consist of sugar and gum. And the gum gives the strength and cohesiveness to the lozenge and facilitate the slow release of the medicament. And it is used to medicate the mouth and the throat for the slow administration of some drugs or a cough remedy or soothing of the throat. Another one is pastulas. They are solid medicated preparations designed to dissolve slowly in the mouth. They are softer than the lozenge and their bases are either glycerol or gelatin or acacia and sugar. Dental cone, a tablet form intended to be placed in the empty socket following a tooth extraction for preventing the local multiplication of pathogenic bacteria associated with tooth extraction. The cones may contain an antibiotic or antiseptic. Pills. Pills are oral dosage forms which consist of spherical masses prepared from one or more medicaments incorporated with that excipient. Pills are now rarely used and no longer it is a market. Granules. Granules are another solid dosage form are dry aggregates of the powder particles, often supplied in a single dose packet. Some granules are placed on the tongue and swallowed with water. Others are intended to be dissolved in water before taking. Effervescent granules evolve the carbon dioxide when added to water. Powder. Other solid dosage forms are powders. These are bulk powders or divided powders. Bulk powders are multi-dose preparations consisting of solid and loose dry particles of varying degrees of fineness. They contain one or more active ingredients or with or without any excipient. If necessary, the coloring material or flavoring substances are added to the bulk powder. And usually they are non-potent medicaments. Okay? And sometimes these powders are dissolved in 1 glass of water before taking. And divided powders, these are divided powders available as a single dose in a single sacket for one use. This sacket has to be either dissolved or swallowed as it is or added to water and it can be drank. Powders for mixtures. Mixtures, powders are maybe stored in a dry form. Mixtures prepared by the pharmacist when required for dispensing or by suspending the powders in the appropriate package. Liquid preparations, the first one all we discussed is like a solid dosage from tablets, capsules, powders, granules. Now we have come to the liquid preparation. Liquid preparations, again, oral solutions, oral emulsions, oral suspensions, lotions, liniments, all these come into the liquid preparation. Oral solutions are clear liquid preparations, preparation used for containing one or more active ingredients and dissolved in a suitable vehicle. They are clear solutions. Oral emulsions are stabilized by oil and water dispersion, either both phases which may be contained or a dissolved solid. Oral suspensions are liquid preparations for oral containing one or more active ingredients suspended in a suitable vehicle. Oral suspension may show a sediment which is readily dispersed and taken to give uniform suspension which remains sufficiently stable to enable the third dose of the delivery. And other liquid dosage form is syrup. Syrup is like a simple syrup and most quantity of the syrup is contained with sugar and some flavor where medicament is added. And elixirs are another liquid preparations. There is alcoholic substances present in there and the alcohol might will be acting as a preservative or antimicrobial activity and some dissolved substances will also be there in the ethanol. Another one is linctuous. Linctuous are viscous and liquid oral preparations that are usually prescribed for relief of cough. They contain high portions of syrup and glycerol, which have a emulsient effect on the membranes of the throat. Another liquid dosage form is oral drops. Oral drops are sometimes they use it for the vitamins for the kids, and they are intended to administer in a small volume by measuring device. These can be either solutions or suspensions or emulsions. Other one is a gargle. Gargles are another liquid dosage forms used for the prevention and treatment of throat infection. Usually they are prepared in a concentrated solution with the directions to the patient to dilute with a warm water before use. Another one is a mouth washes. Mouth washes are similar to gargles. They will be used for the oral hygiene and they treat some infections in the mouth, like a gingivitis. And another one is a cream. Creams are topical dosage forms. They are semi-solid in nature. Creams are especially semi-solid emulsion. And they are either mixtures of oil in water or water in oil. Oil in water means the oil is dispersed where the medicament is dissolved and water is in a continuous state. Same with the water in oil. Water is dispersed and oil in a continuous phase. Both are stabilized by the surface. Gels is another semi-solid system with liquid phase is constrained within a 3D polymeric matrix. Okay, either natural or synthetic, having a high degree of physical or chemical process. And they are used as a medication, lubrication, some miscellaneous applications like carrier for spermicidal agent to be used intravaginally. Other one is a poultice. Poultice is a soft viscous pastry preparation for external use. They are applied to skin while they are hot. Poultice must retain heat for a considerable time because they are intended to supply warmth to inflamed part of the body. Example is kaolin poultice. Paste. Paste are basically an ointment, but higher proportion of the solid material will be present and it is insoluble in nature. The extraordinary amount of particulate matter stiffens the system. Pastes are less penetrating and less macerating and less heating than the ointment. Pastes make particularly good protective barrier when placed on the skin, and the solid they contain can absorb, thereby neutralize certain noxious chemicals before they ever reach the skin. Like ointment, paste form an unbroken, relatively water impermeable film. Unlike ointment, the film is opaque, therefore can be used as an effective sunblock accordingly. Another one is the topical dosage forms of transdermal patch. Transdermal patches or skin patch is a medicated adhesive patch that is placed on the skin to deliver the specific dose of medication through the skin and into the bloodstream. An advantage of transdermal drug delivery route other than types such as oral, topical, extra is that it provides a controlled release of the medicament into the patient. And the first commercial available patch are copolamine used for the motion sickness. Other one topical drug is plasters. Plasters are solid or semi-solid masses adhere to the skin when spread upon a cotton felt line or a muslin as a backing material, and they are mainly used to support the protection and mechanical support. Furnish and occlusion or maceration action bring medication into close contact with the surface of the skin. Another topical preparation is liniment. Liniments are fluid or semi-fluid or occasionally semi-solid preparations intended for the application to the skin. They may be alcoholic or oily solutions or emulsions. Most are massaged into the skin, counter-heated. Liniment should not be applied to broken. Lotions, this is another topical dosage form. They are fluid preparations for external application without friction. They are either dabbed on the skin or applied on the suitable dressing, covered with a waterproof dressing to reduce the evaporation. Another topical is collodion. Collodion is a solution of nitrocellulose in ether or acetone, sometimes with the addition of alcohol. Its generic name is pyroxylin solution. It is highly flammable. As a solvent evaporates, it dries to a celluloid-like film. And this is used for the water remover. Paints are liquid application to the skin or a mucous membrane or a throat. Skin paints contain volatile solvent that evaporates quickly to leave a dry resinous film of medicament. Throat paints are more viscous due to high content of glycerol, designed to prolong contact of the medicament with the affected site. Pressurized dispenser, aerosol spray. Several different types of pharmaceutical products may be packaged in a pressurized dispenser, known as an aerosol. Surface sprays produce droplets of 100 micrometer diameter or greater. May be used as a surface disinfectant, wound or burn dressing, relieve irritation of pipes. Spray and dusting powders are also available for pressurized containers. Another one is the enema. And enemas is the procedure of introducing liquid into the rectum or colon via anal route. Okay, these are all called rectal dosage. And there are different types of enemas. Evacuant enemas. Evacuant enemas are used for the bowel stimulant through the constipation. Example is the soft soap. And the volume of evacuant enemas may reach up to 2 liters. They should be warm to body temperature before administration. Second part is retention enemas. Retention enemas are used for the local effect or systemic effect. And their volume does not exceed to 100 ml. No warming is needed. Local effect is a barium enema is used as a contrast substance in the radiological imaging of bowel. Systemic effect is the administration of substance into the bloodstream. This may be done in a situation where it is possible to deliver a medication by mouth such as anti-emetic. Nutrient enemas, which contains a carbohydrate, vitamin, and mineral. Next one is vaginal dosage form, vaginal ring. These vaginal rings are donut-shaped rings, polymeric drug delivery devices designed to provide the controlled release of drugs to the vagina over extended period of time. Several vaginal ring products are currently available, including Fem ring and Nuva ring. Fem ring is a low-dose estradiol estate releasing ring manufactured from silicone elastomer for the relief of hot flashes and vaginal atrophy associated with menopause. Nuva ring, low-dose contraceptive vaginal ring releasing a progesterone and estrogen. Another vaginal dosage forms are intrauterine devices. Intrauterine devices is for the prevention of contraception and a birth control. Okay, they are also called intrauterine devices or coil. Intrauterine devices is mostly used method for reversible birth control. The device has to be fitted inside and removed from the uterus by doctor. It remains in the place entire time pregnancy is not desired, depending on the type. Like they can up to use 5 to 10 years of use can be done. There are two broad categories of intelligent contraceptive devices. One is inner or a copper-based device, hormonally based device that can work by releasing the progesterone. Next dosage form is parenteral dosage. Parenteral dosage forms are injection and infusion method of putting liquid into the body, usually with a hollow needle and syringe which is pierced through the skin to sufficient depth for the material to be forced into the body. There are several methods of injection, including the intravenous injection. Intravenous is directly entered into the bloodstream. Onset of action is very quick. Next one is intramuscular injection. Intramuscular injection or subcutaneous, it can be given into the muscle, intramuscular. Many vaccines are administered like this. And depending on the chemical properties of the drug, the medication may be either absorbed fairly quickly or more gradually. Intramuscular injections are often given in the deltoid or vastus lateralis or ventrogluteal or dorsogluteal muscle. Injection fibrosis is a complication that may occur if the injections are delivered with a great frequency or with an improper technique. That is the demerit of the injection. Subcutaneous injections. Subcutaneous injections are given by injecting a fluid into the subcutaneous, the layer of skin directly below the dermis and epidermis. Subcutaneous injections are highly effective in administering vaccines and such medications as insulin. Next dosage forms are inhaler. Inhalers, these are the solutions, suspensions, or emulsions drug in the mixture either the propellant held under the pressure into an aerosol dispenser. Release of dose of medicament in the form of droplets of 50 micrometer diameter are less from the container through spring-loaded valve incorporating a metering device. The patient then inhales the released drug through the mouth. In some times, the valve is activated by finger pressure. In other times, the valve is activated by patient breathing into the mouth. It is commonly used to treat the asthma or respiratory problem or coronary obstructive pulmonary disease. Next one is a nebulizer or automaton. A nebulizer is a device used to administer medication to the people in the form of liquid moist to the airways. It is commonly used in treating asthma, other respiratory diseases, and it pumps the air or oxygen through the liquid medicine into the vapor. The general rule, doctors generally prefer to prescribe inhalers for their patients because these are cheaper, they are more portable, carry less risk of side effects. Ophthalmic dosage forms, another form of a dosage form, where eye drops or ophthalmic ointments as well. Eye drops are the saline containing drops used as a vehicle to administer medication to the eye. Depending on the condition being treated, they may contain steroids or antihistamines or topical anesthetic. And ophthalmic ointment or gels, these are sterile, semi-solid preparations intended to apply to the eye or to the conjunctiva or eyelid margin. Ear drops, this is another dosage form which will be dispensed into the ear. These can be solutions, suspensions, or emulsions of drug instilled into the ear with a dropper, and these are used for the treating the infection in the ear or moistening in the ear. Nasal drops or sprays. Nasal drops or sprays are instilled into the nose from the dropper from the plastic pill bottle. There may be local effect like antihistamines or decongestant. Alternative, by the drug may be absorbed through the nasal mucosa to exert a systemic effect. The use of oily nasal drops should be avoided because of the possible damage to the cilia of a nasal mucosa. There is another dosage form they call intermediate drugs used in a compound. That they are extracts, glycerins, or infusions. Extracts are nothing but concentrated preparations containing the active principle of vegetable or animal drugs, which have been extracted with a suitable solvent and concentrated to form a liquid, soft or dry extract. Glycerins, these are the solutions of medicament in glycerol, which are without the addition of water. Infusions, these are a dilute solution containing readily soluble constituents of two drugs and prepared by diluting 1 part of concentrated infusion with 10 parts of water. Concentrated infusions are prepared by cold extract of fruit drugs with a 25% of ethanol. And other intermediate products are oxymel. These are preparations which vehicle is a mixture of acetic acid and honey. And spirits. They are alcoholic or aqueous alcoholic solutions of volatile substance used as a flavoring agent. Tinctures. These are alcoholic preparations containing active principles of vegetable structure. They are relatively weak compared to extract. Aromatic water, they are aqueous solutions, usually saturated of volatile oil or other volatile substances used as a flavoring agent. And thank you everyone. And this is all about the different types of dosage forms which are used for the pharmaceutical purpose.